Hi, my name is Arthur Tovar. I'm a chiropractor. I have decided to start doing these videos because a lot of my clients have usually questions beyond the health talk that I have before they start care. So I decided to start answering some of these questions here via this channel called YouTube. Hopefully I will get some feedback from my clients or from anybody else out there that's interested in health and in chiropractic so I can continue making new content. So today's topic is, why should I get adjusted? Why should I see a chiropractor? Usually most of my patients, when they come see me, they usually bring their spouse. But some of them don't bring their kids, some of them don't bring their girlfriends, some of them don't bring their loved ones. And usually when I ask them, where's your wife, or where's your husband, or where's your boyfriend, they usually get the same response, which flabbergasts me or impresses me, because I ask them, how come your husband is not getting adjusted? Or how come your wife is not getting adjusted? And I always get the same answer. And that answer is, well, they feel fine. They have no pain. They're okay. So I usually ask them, what do you mean they're okay? How do you know that they're okay? Well, they're okay because they just feel fine. They have no back pain. So they automatically assume that, like most people, that chiropractic care is for back pain, when in reality that's not true. And how do they know that they're fine? They understand that chiropractic is a total health approach. So I usually ask them, how do they know whether they have high cholesterol or whether they have high blood pressure or not? Well, they don't. The only way is to get a test done, correct? So they go to the GP and get this test done. Right, so the same goes with chiropractic. How do you know that you're fine? How do you know you have no subluxations in your spine? You will not know if you were to gauge your health by pain or symptoms. It's a poor way of gauging your health. So we try not to gauge your health by pain or symptoms, and we know this already because we're already doing it. We don't wait until we have pain or symptoms before we go get screened in a hospital, right? So we get blood checks, we get cholesterol checks, we get mammograms, we get prostate checks after a certain age. We go see our dentist regularly. We don't wait until cavities set in our teeth. Yeah, hopefully, yes. And we do all these things because we know that by the time pain arises, it's too late. What do I mean it's too late? It means that the problem's already been there in your spine or in your body for quite some time. Same way a cavity will be in your tooth for some time. You don't wait until you get the pain, because by then it's very, very, very difficult and you may even lose a tooth, okay? So the difference between a tooth and your spine is that if your spine with time were to degenerate, then your spine can become problematic and you may end up having surgery and you will have a lot of health problems. So we don't wait until this happens. You want to get your spine checked before this arises, okay? So it makes sense to get your spine checked as soon as possible by a qualified chiropractor that could take a look at your spine, look at your posture, and make sure that you have no subluxations in your spine, and help you, give you tips on how to maintain yourself subluxation free for longer. In other videos, I will explain you what a subluxation is and what chiropractic is. Thank you very much. Yours in health, Arthur Tovar.